Hey guys, welcome back for another video on our Study With Me series for this month. Today I will be covering from Cardiology, Pulsus Paradoxus, as I mentioned in the previous video. So when you looked today, you should see two videos because apparently I had some technical issues, so it didn't do what it needed to do for yesterday for my respiratory video on tuberculosis. So check out both of those. And as I was telling you on yesterday's video, to include any other things you want me to cover. So for MP week, I'll get into the topics that y'all have requested. Okay. But as always, welcome back, you guys. And for those that are new to me, hello, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner and I am the founder and CEO of the Nursing Studio. I design all of this content and material to aid nurses and nurse practitioners on exams, boards, and practice. Okay. You know, medicines, there's no absolutes. We treat people on a patient by patient basis. So when I give you these videos, think of that in that fashion. Okay. I like to give that disclaimer, but let's get into the material. All right. So when I'm talking about Pulsus Paradoxus, you'll see here, I want you to think of what it is, the presentation, potential causes, and if there's any treatment options that we need to do, okay? So what is Pulsus Paradoxus, right? And let's start from the top. And, I'll tell you to break it down in this fashion. So I'm going to try to provide it to you like that. I know this is something that's not exactly like our typical conditions, so but I'll give it to you in the foundation to kind of assist your thinking. So pulsus paradoxus is just simply where the systolic blood pressure is dropping by 10 millimeters of mercury or more, right, during the inspiration. So like when somebody sorry when when during inspiration and we are gauging this blood pressure, you'll see a change in that systolic BP by 10 millimeters of mercury or more. Now, there are various things that can cause this. So, when I say what it is in the presentation, that can kind of go for both um, of what I was just explaining, just that 10 millimeter decrease or more. Um, but the main thing to kind of give you a foundational knowledge, typically in the phases of like your respiratory phases and cardiac phases, right? So, in those phases, typically when somebody during that inspiration phase, when someone is inhaling, typically there is only a small variance in that systolic arterial pressure, right? But when um when there is an abnormality, and we'll get into potential causes in those phases, then the systolic phase decreases more than that 10 millimeters of mercury that I discussed. Okay, makes sense. So if I slow it down and try to give you just cut and dry as much as I possibly can, pulsus paradoxus is when your systolic blood pressure has a 10 millimeter per mercury decrease or greater on inspiration, right? And I was just explaining different like the mechanism basically so you can get a better understanding, but that's just a clear cut of what you need to know. Now, potential causes, it could be things cardiac related like cardiomyopathy, severe heart failure, cardiac tamponade. It could be respiratory things such as sleep apnea, COPD, asthma, things of that nature. And this can also have hereditary effects. So there's some variances that we can't completely give a specific cause to, but it has been seen that a lot of these diagnoses can cause and contribute to that because there are some alterations in that respiratory phase that I was mentioning and cardiac phase as well. Okay. So just in simplest terms, I want you to understand when you're looking at this, what I mainly want you to know for this is understanding, because this is not, like I said, this is not our typical condition diseases that we talk about. So it's a different perspectives to look at, but something that some of my review students struggle with. So I wanted to do a quick video on it. But I really just want you to understand that with Pulsus Paradoxus, I want you to be able to identify it, right? If you ever encounter it. And knowing that it is when there is a systolic decline of 10 millimeters of mercury or greater. Because when you see that, you're not looking to treat the Pulsus Paradoxus. You're looking to treat the actual pathology that has caused this, right? So in the grand scheme of things, like when I say like cardiac tamponade can cause this, those are emergent cases, right? So you really want to be able to identify that and then go and look for the cause so that you can know if you need to refer out or whatever additional treatment based off of where you're practicing from to provide that the treatment, because the severity can be very high based on the underlying cause. So I hope that makes sense. That I was trying to define the best way to say that to make it easily understandable, because one, again, cardiology is my background, so to me it I get it just from doing it so much and being around certain things so much. But students have come to me and said, like when they see it in that fashion, they struggle with it. But when you're thinking of this in testing purposes, I want you to think of, you know what it is, right? And understanding how it may be caused, what may be the potential cause, and what to do next. So then if you see a test question, those test questions will be formulated more so to let you know that there was a systolic blood pressure the systolic blood pressure was 150, right? And then when it was checked again on inspiration, it was 130, or whatever. So that's you know, greater than 10 millimeters of mercury decline in that systolic. So to you on a test question, that should warrant you to say, that looks like Pulsus Paradoxus. Let's see if in the scenario that it mentions any other underlying issues. Let me go and see if it's talking about cardiac tamponade or anything like that, and if I may need to potentially refer them out for an emergency case for a higher level of care, etc. So that's all I wanted to say, so you can gauge your mind on that. This was more of a short and sweet one. I hope that was clear as mud. Hope it's helpful for you guys to give you the breakdown of that. But also check out the other video. It's a little bit longer as I go into TV. And then please put your stuff in the comments, and I'll be working to get these videos and content recorded for you guys for next week, because I'm just going to hit everything that y'all asked for in celebration of MP week, and let's go from there. But as always, you guys, thank you, thank you, thank you for watching. Please like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Again, here's my contact information that you may reach out to the nursing studio if you need any one-on-one assistance or any of our review courses, or just simply want to ask me a question. Feel free to reach out and meet me back here. Bye, y'all.